Hello all, let's talk about quality improvement project. The quality improvement project is a systematic data-driven approach to improve processes, for example, fault risk assessment, patient outcomes like ER waiting time or system performance within a specific setting. By using evidence-based methods to identify gaps and testing small area like piloted it in small units and making incremental changes. So this aims to enhance efficiency, safety, and care quality. So there are a lot of methodologies. Two of them are PDSA and DMAIC. We will talk about DMAIC. Define, measure, analyze, improve, and control. Used in Lean Six Sigma. So define, identify the problems to be solved, like project goals and scope. So what is define means the problem, what is the problem, and what are the project goals and the scope, that is inclusion and exclusion. Measure. Collect the baseline data to understand the scope of the problem. So you already know the problem, you already defined, now you have to measure what is the baseline data, what is the extent of the problem. Then analyze to determine the root causes of defects or inefficiencies. So you have to analyze what is the problem of what is the cause of the problem. Then improve. So develop, pilot, and implement solutions that address the root cause to improve performance. So you implement that solutions into a small area and you see. So once it is successful, then it should be disseminated to all units, right? Roll out. Control. Control means monitor the improved processes to ensure sustainability and prevent reverting back to old practice. So once you reach the sustainable stage, you have to do small audits to keep it sustainable rather than going back to the old practice. So there are few elements of quality improvement project charter. They should have a title, the date started. Project leader is the one who lead the project. Some of the project should have a project sponsor who will allocate resources. Then project team members, there will be 5 to 6 project team members. Then project drivers. What are the project drivers? Is it a safety report, or is it a patient experience or a staff experience, or is it something related to your accreditation, or there is a problem in the unit? So what is your project driver? Then problem statement. So the problem, what is the extent of the problem that you have at the moment? For example, you have a lot of faults in that unit. So the fault rate is higher than the international benchmark, that you wanted to make it lower. So this is your problem statement. Then the goal should be always smart. It should be specific, measurable, attainable, and it should have a time bound. So let's say your fall rate is high. You wanted to reduce the fall rate from 0.5% to 0 by December 2026. So that is how you need to write the goal. Inclusion, exclusion, which are the units included in this project, which are the excluded, like inpatients or outpatients, or like within that unit, like bed-bound patients excluded, or ambulating patients included, like that. Then measures. The measures are process measures, outcome measures, and balancing measures. The process measures are what are the processes, like for example, if reducing the fall rate is your outcome measure, then the processes like how many patients who receive education, how many patients have proper care plan documented, how many staff who did proper e-learning module. So these are the process measure, and the balancing measure is something that is not wanted one. For example, we have a restraint project that you remove the restraint of the patient, and then the patient is removing the central line or the peripheral line. So there is a lot of decannulation or tube dislodgement. So the percentage of tube dislodgement is the balancing measure in that particular project. So the balancing measure is the unwanted thing that we don't want to happen. And then you write all the items, like define what is the time you are planning, and then what is the actual time it happens, and what is the comments. You have to put all of those. So define, measure, analyze, improve, and control. You have to put all those step by step. What are the planned date, what is the actual date happened, and then what are the comments. So that is how you need to write the project chart. Thank you, and see you in the next talk.